For this lecture, I'm going to be pointing at some of the things behind me, but you can just kind of ignore it. Mostly just listen to what I'm talking about. So this is vascular pathology, particularly vasculitis. So first of all, understand what vasculitis is. Vasculitis is essentially your blood vessel is inflamed. It has an unknown etiology, and it's usually, however, it's not infectious. It's usually due to something else. Oftentimes, it'll present with one or two of, or maybe both, non-specific symptoms, which is kind of defined as like flu-like symptoms, like you ache, you have fatigue, maybe weight loss, myalgia, those kinds of things, and or organ ischemia in the form of, or rather, I should say, this organ ischemia occurs because of either a thrombosis or because of inflammation. Let me explain. So if your blood vessels become inflamed, so here's a blood vessel, then sometimes the inner layer of cells, the endothelial cells, will get so inflamed it'll expose some collagen, and that collagen can start a blood clot, which will cause make it more difficult for the blood to travel through there, and that'll cause ischemia of the organ. The other thing that can happen is that this simply gets so inflamed that very little blood can pass through, and that would also cause possibly ischemia of organs. Got to remember also that on blood vessels there are three layers. There is the intima, which is the one on the inside, and then there's the media just outside of that, which is the muscle, and then there's the adventitia. The intima, the inner one, is composed of endothelial cells and basement membrane, and the media one, I said earlier, is smooth muscle, and the adventitia is made out of connective tissue. So when you're going to look at vasculitis, they typically divide it into three different categories. Usually it's divided into large vessel, medium vessel, and small vessel vasculitis. Large vessel vasculitis is temporal or giant cell arteritis and Takayasu arteritis. So those are the two ones that are large vessel, temporal and Takayasu, both T. Whereas the medium vessel arteritis is composed of three different ones, and those are polyarteritis nodosa, Kawasaki disease, and Berger disease. And small vessel vasculitis is Wegener's granulomatosis, microscopic polyangiitis, and Churg-Strauss syndrome, and HSP. So we're going to be talking about everything in that order, starting with large vessel, the two different large vessel vasculitis. So first of all, when we say large vessel, we're referring to the aorta, or the major branches of the aorta. And so remember, the aorta comes right off the heart like this, and some of these main branches come right up here. One of them is right up in here, goes into your head. So there is the, if it infects the, I should say, it is most common, this is the most common kind of vasculitis, and it typically happens in people that are greater than 50, and more often females than males. And this is the branches of the carotid artery. So remember, the carotid artery is the one that comes up like this, and this is its branches. And if you think of where its branches are going to go, they're going to go up like this. One of them is going to go up into the temporal, which can give you a headache. The other one's going to go the ophthalmic, which is going to give you visual disturbances, and depending on which one hits is going to cause different problems. So sometimes it can also get the ones going into your jaw, which will cause jaw claudication and pain, and flu-like, also can cause joint and muscle pain and flu-like symptoms. Your erythrocyte sedimentation rate is typically elevated. That seems to be the case with most of these. In other words, they put your blood in here and they see how quickly it takes for it to sediment or whatever. Under a biopsy, you're going to see inflamed vessel wall. So look at the vessel wall, and it's going to be inflamed with giant cells. So basically, this big cell with a bunch of these nuclei along the side of it, and that's what you're going to see. The intimal You're also going to see intimal fibrosis. So I guess just underneath the intima, it's all fibrous tissue, and also granulomatous vasculitis. So I'll let you look that up. Typically, what you're going to see with this too is something they call it segmental lesions. So it may not be everywhere. If you really want to biopsy this to find out if the person has it, you have to get a big segment and you have to check in lots of different places. And if you don't find it, it doesn't mean that they don't have it, because sometimes people have it even when you don't find it. You're going to treat this with corticosteroids, because if you don't treat it, the person, because it is affecting the ophthalmic artery, the person can go blind. Okay, so now we've talked about temporal giant cell arteritis. Now we're going to talk a little bit about Takayasu's arteritis. Now, these are pretty much the same thing, except for Takayasu's arteritis is more proximal, kind of the more proximal aorta, whereas like the aortic arch at the branch points, whereas this was more distal, like going up into carotid and things like that, the ophthalmic and the temporal. So Takayasu's arteritis is pretty much the same thing. It's a granulomatous vasculitis, adults greater than age 50. It's basically on a spectrum as temporal giant cell arteritis. It typically affects the aortic arch at its branch points. And because of that, if you remember that here's the aortic arch, like here, it branches off like this. So it's going to be supplying these sorts of things, and also your arms. Because of that, you're going to have visual and neurologic symptoms. Blood vessels going up to your brain and your eyes. And also, since it's the branch points, the other ones go out here to your arms, you're also going to have, when you take someone's pulse, that it's going to be really weak. And just like the other one, you're going to find that there's an elevated erythrocyte sedimentation rate, ESR. Okay, so now we've just covered the large vessel vasculitis. So now let's move from the large vessel vasculitis and talk a little bit about the medium vessel vasculitis. So this type of vasculitis typically is going to affect the muscular arteries that go to the organs. Particularly the renal artery is really common. So there's three diseases here. There's polyarteritis nodosa, Kawasaki disease, and Berger disease. So first of all, polyarteritis nodosa. So poly means many, arteritis means inflammation of the arteries. So many arteries are inflamed, and it has this little nodule appearance on it. That's because when it does get inflamed, it'll typically have an area that's all inflamed like this, and then right next to it, you'll get this granulomatous material. Right next to it, you'll have this little aneurysm, and then you'll have another little area that's inflamed, and you'll have a little aneurysm, another area and it'll kind of do this sort of thing. And it looks like a string of pearls, but they look like little nodes here on biopsy or whatever. So this is a necrotizing vasculitis. Typically, remember, it's poly, so many. It does involve most organs. And however, the interesting thing about this one is that you can determine it from the other one because the lungs are spared. So it does not get the lungs for some reason. It does get, however, the kidneys very often, and that'll result in hypertension. If it doesn't get the kidneys, it might get the mesenteric artery instead of the renal artery, and in that case, the person would have all these abdominal problems, abdominal pain, and that sort of thing, and melena and whatnot. It often happens in young adults. You'll also see some neurologic disturbances and skin lesions, as well as, this is an odd one, you'll find serum hepatitis B immunoglobulin. So that's an odd thing they'll find with that. And I already mentioned the string of pearl appearance and the fibrinoid necrosis. That's kind of this little thing here. A little fibrinoid necrosis causes those things between the aneurysms. And the treatment is going to be corticosteroids and cyclophosphamide, which is kind of the treatment for most of these things. Because again, it's a itis, so it's an inflammation. So you're just going to treat it like you would any other inflammation. Okay, now we're talking a little bit about small vessel. Now that we've talked about medium, we're the small. This is talking about arterioles, venules, and capillaries. So there are 4 of them. Wegener syndrome, W-E-G-E-N-E-R, microscopic polyangiitis, Churg-Strauss, and HSP. Okay, so an important way to kind of differentiate these is the C ANCA versus the P ANCA. But I'll explain all of it. I'll go through all of it. So Wegener granulomatosis. So Wegener granulomatosis is a necrotizing granulomatous vasculitis of the nasopharynx, the lungs, and the kidneys. Okay, so in this case, one of the ways that the person thinks to remember this is there's a lot in Wegener that has to do with the letter C. I don't know if this will work for me or not, but basically they drew a picture of a person like this, and here's their nose, and here's their lungs, and here's their kidney out here, and they drew this C through it like that, and they said it got their nose, nasopharynx, it got their lungs, and it got their kidneys. And they said the C is important because remember this is C ANCA, and they changed the word Wegener to Wegener with a C, and they said also you treat it with cyclophosphamide. So there's all these C things associated with Wegener's granulomatosis. It is a sinusitis or nasopharyngeal ulceration is common with it. Hemoptysis with dilated lung infiltrate, bilateral lung infiltrates. So remember this affects the lungs and the nasopharynx. And hematuria due to rapidly progressive glomerular nephritis. So that's the kidneys again. So those are the three things I just mentioned. Hemoptysis with lung infiltrates, rapidly progressive glomerular nephritis, which is the kidneys, and the sinusitis and nasopharyngeal ulceration. On biopsy, you're going to see large necrotizing granulomas with adjacent necrotizing vasculitis. Okay, so now we talk about Wegener's syndrome, and that's the C ANCA. Now these next two are going to be P ANCA. Okay, so microscopic polyangiitis is P ANCA, and Churg-Strauss syndrome is P ANCA. So first of all, microscopic polyangiitis, necrotizing vasculitis of many organs, which poly means many, so many organs, but typically it's going to be the lung and the kidney. So one way that you might kind of separate this from Wegener syndrome, besides the fact that it's a P ANCA instead of a C ANCA, is that this one doesn't affect the nasopharyngeal aspect. It doesn't have the nasopharyngeal aspect. So that's a way you can kind of differentiate those two. So next, Churg-Strauss syndrome. In this case, Churg-Strauss syndrome is a necrotizing granulomatous vasculitis with eosinophils. So right there are some ways you can differentiate Churg-Strauss syndrome from microscopic polyangiitis. They both are P ANCA, but the difference here is that microscopic polyangiitis did not have granulomatous vasculitis. This microscopic polyangiitis had necrotizing vasculitis. The difference between necrotizing for microscopic and Churg-Strauss has granulomatous. Okay, so this one has the granules that Churg-Strauss does. It is also it has the eosinophils. And another thing to help you remember Churg-Strauss syndrome is that it's also associated with the multiple organs, usually lungs and heart, but it has asthma and peripheral eosinophilia. So asthma is associated with Churg-Strauss syndrome. And sometimes when I think of asthma, people describe, imagine breathing through a straw, and this looks like Churg-Strauss, looks straws. So maybe that'll help you remember that asthma is associated with Churg-Strauss syndrome. And again, this is the P ANCA. So now the last one that we have here is going to be our HSP, and I can't remember what that stands for, and I apologize. But this is going to be the vasculitis from IgA complex. This is the most common in children. It's palpable purpura on the buttocks and legs, and this is associated with GI pain and bleeding and hematuria. And it's usually after upper respiratory tract infections. And this has to do something with the IgA neuropathy, or nephropathy, or whatever. So the IgA, I guess, is kind of what coats your breathing tract, whatever, and your lungs and whatnot. And so the IgA is what it's associated with. So you get a respiratory tract infection, and that is going to be the infection there involving your IgA, and so it ends up being the IgA that has a problem. So that's how you can remember the HSP.